Okay, this video is going to be about the endocrine system. We're going to go over the endocrine system, male reproductive system, and the female reproductive system. There'll be some videos that are included in this that you can find online, so you can see the slideshow then. But I'm going to explain the slides as I see them now. Then you can actually go back in if you want to and watch those videos within the slideshow, so I'm not going to have them in here. So what the endocrine system does is it regulates growth and development. The endocrine glands are cells that secrete hormones directly into the bloodstream. So what are hormones then? Are chemical substances that help regulate many of the body's functions. They influence physical and mental responses. During puberty, they trigger physical changes in the body, which are different for males and females, which we're going to get into. The thyroid gland is on the neck, so it's in the neck. So it produces hormones that regulate your metabolism, body heat, and bone growth. Your metabolism is how readily you burn fat. The parathyroid gland, also in the throat area, produces a hormone that regulates the body's calcium and phosphorus balance. So again, calcium would be like the hardness of your bones. So even though it's located in the throat, that's what it's responsible for. The pituitary gland regulates and controls the activities of other endocrine glands. So it's more of a one that's in charge, like a puppet master. Adrenal glands help the body recover from stress and respond to emergencies. So you probably heard the term adrenaline before. Adrenaline is from adrenal glands. So if you can all of a sudden, if you're doing some really hard activity and all of a sudden you notice later on that you have a cut on your leg, you may not have noticed, how in the heck did I notice I have this big cut on my leg? It's because you had a bunch of adrenaline going through your body. However, if somebody came up to you and cut you with a knife, you'd feel all that pain right away because you didn't have the adrenaline going through your body. Problems with the endocrine system. One thing could be a goiter, which is the enlargement of the thyroid gland, which again is located on the neck. This is typically caused by a lack of iodine in the diet. And this now is not a particularly hard thing because sodium is so ingrained into our diet now that this is one of the things that's actually good about a bad diet is you naturally have a lot of iodine in it. Okay, you can go through a Kahoot dealing with that part right there so far. We're going to move on past the endocrine system into the male reproductive system. The male reproductive cell is the sperm. It has a head, a body, and a whip-like tail. And this video right here, what you would watch, shows what a sperm actually looks like. So you're going to notice when you're watching the video, it looks kind of weird because it's clear in color and it's got a body and it's got like a long whip-like tail that's going to move it along. During each man's ejaculation, 300 to 400 million sperm are in each ejaculation. A healthy male will produce sperm for the rest of his life as soon as he goes through puberty. This is the opposite of a female, because a female at a certain point will not be able to get impregnated because her body's not capable of having that happen anymore when she goes through something called menopause. But we'll get into that when we get into the female. Testosterone is the male sex hormone. That's what actually initiates the physical changes in the body between the ages of 12 to 15, which is the main ages of puberty typically. This would be broadening of the shoulders, so the shoulders get wider, development of muscles, facial or other body hair, deepening of the voice. So if someone's under the age of 12, typically they struggle to gain muscle mass. And the reason why they can't get muscle mass yet is because they haven't gone through puberty yet. So until you've gone through puberty, you can get stronger, but it's harder to develop bigger muscles. Okay, the external male reproductive organs. The first ones are the testes or testicles, are two small glands that produce sperm. They also secrete testosterone. So you're going to need to know the two things that the testes do is they produce sperm and secrete testosterone. The scrotum is where the testes are kept. It's an external skin sac. It protects the sperm by keeping them at a constant temperature. So when it's cold outside, the scrotum's going to shrivel up and bring the testicles closer to the body to keep them warm. And when it's warmer outside, it's going to hang looser and keep the testicles away from the body. Try to keep them at a constant temperature. The penis is a tube-shaped organ that extends from the trunk of the body to just above the testes. it contains many blood vessels that for the majority of the time are empty. Now, when a male gets an erection, that's when blood vessels fill the penis. So it's not some random bone that goes in there or water that floods into the penis. Basically, those empty blood vessels get filled up with blood, which causes an erection, which happen often more frequently during puberty and sometimes for no reason. Semen is the thick fluid containing sperm and other secretions released from the penis. Ejaculation is a series of muscular contractions that release the semen. Boys will often get something called a nocturnal emission, where they ejaculate during their sleep. They may think that they wet the bed or peed their underwear a little bit, when it's actually, this is what it is, and it's a common occurrence for people that are going through puberty. Fertilization, which is going to be on here a lot, is the joining of an egg cell and a sperm cell. Path of the sperm is something you're going to need to know. So the sperms are formed in the testes. It goes from the testes to the epididymis. The epididymis is attached to the testes, and that's where the sperm actually matures. So it goes from the testes to the epididymis. From the epididymis, it goes into these tubes that are called the vas deferens. So they extend from the epididymis to the urethra. So if somebody would get something called a vasectomy, that's where a male can't impregnate a woman anymore. Basically what they do is they would cut those tubes of the vas deferens in order for him not to actually have sperm released when he ejaculates. Then it will go to the prostate gland and the Cowper's gland, where it secretes a fluid to combine with sperm to produce semen. So again, a man would ejaculate fluid still, even if there wasn't sperm in it. There's a valve that covers the bladder during ejaculation. So when a man, and actually when he has an erection. So when a man has an erection, a valve covers that area. So the pee and the semen wouldn't, in theory, go together. Now, a male can actually physically open that themselves. So if he has an erection, he has to go to the bathroom. He has to physically push it out and open that hole himself. The urethra, finally, is a passageway in which both semen and urine leave the body. So you're going to need to know those 5 stages. The bladder doesn't count because the sperm wouldn't go through the bladder. So again, this will be another video that you can watch to review the path of a sperm. Care of the male reproductive system is you need to get regular checkups, bathe regularly and clean, wear protective equipment like a protective cup, because hits to the penis and or scrotum can cause permanent damage, which could mean a number of other things, where it could be where the sperm might not work anymore, or they might not be produced anymore, or may not be able to get erection anymore. So a man's supposed to perform regular self-exams on his testicles, looking for abnormalities, because they should be very smooth and not have bumps on them. Great ways to help care of the male reproductive system is practice abstinence, where you're choosing not to have sex, which is going to allow you to avoid STDs and STIs, which are sexually transmitted diseases / sexually transmitted infections. Now, this video is extremely funny. It's about a guy who has an invention. It's called the Nutty Buddy. So it's a special cup that allows you to take more force in that area and for it not to be painful. So if you want to get a good laugh, this video is pretty entertaining. It comes straight off of ESPN when they were doing a science show, which is pretty funny. Problems with the male reproductive system. Again, STDs and STIs, which we're going to cover in greater detail in slides later on. Another one would be an inguinal hernia. So this would be a separation of tissue where the intestine actually gets pushed into the scrotum. And this could happen from something like lifting something extremely heavy, getting in a car accident, or anything in the middle. And this is something that surgery would be needed to repair. Other problems would be sterility. Sterility is inability to reproduce. And this could be because somebody's taking steroids, it could be the medications they're on, or it could be an STD, or it could be any number of other different things. Testicular and prostate cancer can happen anytime after the age of 14. And anytime you have any type of cancer, the only way to truly get rid of the cancer is to cut it out. So if you have had testicular cancer, you might end up only having one testicle. So this would be a cahoot going along with the male reproductive system. Now we're going to move on to the female reproductive system. The ova is female reproductive cells are the eggs. So ova and eggs are the same thing. The uterus is a hollow pear-shaped organ. It nourishes and protects the baby from conception to birth. Conception is fertilization. They're the exact same thing. The fallopian tubes are connected to the uterus. Okay, so you have fallopian tubes coming off the uterus, and the ovaries will be the next thing that's on there. So female sex hormones are produced in the ovaries, which will be estrogen. And that's where the eggs are stored. 400,000 eggs are inside a girl at birth. She does not produce more at any other time. She has a certain amount when she was born, and that's how many she has. Typically, one ovum matures into an egg each month, beginning at puberty, when the pituitary gland starts producing hormones. So if you're going one a month, that would be 12 total, and they actually take turns for size. So it would be 6 from one ovary, 6 from the other ovary in about a year. Ovulation is the process of releasing a mature ovum or egg into the fallopian tube each month. Each month, again, the right and left take turns. The fallopian tubes are where the eggs are released to from the ovary into this tube. A pair of tubes with finger-like projections that draw in the ovum or the egg. So it's not the fallopian tube and the ovary aren't actually physically connected, but the fallopian tubes actually draw the eggs in. So it's almost, you're going to see video of it, it kind of looks like feathers are kind of like grabbing onto an egg, which is kind of crazy to think about. Cilia are hair-like structures that move the egg throughout the fallopian tube. So there's extremely microscopic hairs that move that egg along. The endometrium is the tissue that lines the uterus. So when a woman would get pregnant, that fertilized egg would attach itself to the endometrium. The cervix is the opening of the uterus. And finally, you would have the vagina, which is a muscular elastic passageway that extends from the uterus to the outside of the body. So everything here is outside everything in here is inside until you get to the vagina. The bladder is an area near the vagina region that holds the urine. So a girl actually has a vagina hole, she has a bladder hole, and she has an anus. So there's three different ones for her to worry about. Fertilization, again, is the joining of an egg cell and a sperm cell. Fertilization takes place in the fallopian tube. A zygote is what the fertilization produces, so it attaches itself to the endometrium and begins to grow and stays attached until birth. This is a great video of the female reproductive anatomy, so you can kind of see what it actually looks like as opposed to me just explaining it. Menstruation are muscular contractions that push endometrium out of the woman's body through the cervix and vagina. The endometrium is blood and tissue and fluid, and it can last between 5 and 7 days. So it's not just some random blood that's coming out. It's actually the lining of the uterus, which is known as the endometrium. Typically worn by women to absorb the endometrium would be sanitary pads or tampons. So a pad would just be something they would put in their underwear. A tampon is something that they would actually insert into their vagina. The first menstrual cycle occurs usually between the age of about 10 and 15. The cycle becomes more predictable with age. So as a girl gets older, that cycle will become more predictable. When she's a teenager, that cycle kind of goes all over the place. Nutrition, stress, illness, overexercise can all influence the menstrual cycle that cause it to be harder, to have more cramps, or anything else. Care of the female reproductive system. Bathe regularly. Abstinence prevents pregnancy and STDs. Breast self-exams to make sure there's no abnormal lumps that are in that area. Menstrual cramps are muscle contractions ridding the body of the endometrium. So menstrual cramps are a real thing because it's physical cramps, so they're a muscle continually pushing out the endometrium out of the body, and it's a constant thing happening. Light exercise or a heating pad may relieve some of the pain. Dysmenorrhea is severe, persistent cramping. PMS, or premenstrual syndrome, is caused by hormonal changes. So a female and male are different in many ways, but one of the ways is a female's hormones are not consistent. So the hormone levels will go up and down a lot while a woman's menstruating. The symptoms could include nervous tension, anxiety, irritability, bloating, weight gain and depression, and possibly fatigue. Good nutrition and physical activity may actually reduce some of these symptoms. So it may be more difficult for a woman to actually perform physical activities, but it's actually going to reduce some of the symptoms. Toxic shock syndrome is a bacterial infection that affects the immune system and liver and can be fatal. And this would be when a woman does not change her tampons regularly. So if she would just leave that tampon in there for a long period of time, things start growing in that area and you can develop an infection. Some symptoms include, which is basically a sign of sickness for anything, would be fever, rash, body aches, vomiting, and possibly diarrhea. Things that can cause infertility in a female. Endometriosis is where the endometrium growth migrates to the ovaries and pelvis. So the endometrium is supposed to not be in those areas. It's supposed to be in the uterus and stay in the uterus, and then only come out when the woman's menstruating. Pelvic inflammatory disease is an infection in the surrounding area of the uterus, and it's often caused by STDs. Other things that cause it would be STDs and STIs. Vaginitis is discharge, odor, pain, itching, and burning that can lead to pelvic inflammatory disease, which we've gone over already. And if the fallopian tubes get blocked for any number of different reasons, whether it's endometriosis, STDs, or anything like that, that would also cause infertility. One of the problems is people don't go in to see if they have an STD because they don't have any symptoms on the outside, even though they can remain dormant on the inside for a long period of time. Next one would be ovarian cysts, are fluid-filled sacs on the ovary, and larger ones may need surgery to get rid of. Cervical, uterine, or ovarian cancer. Early sexual activity and STDs are related to increased incidence of cervical cancer. Regular checkups and exams are needed for early detection, and women would typically get a pap smear once per year. And these would be two great videos to watch on the menstrual cycle, which you can watch on your own time, which are in the slideshow. This would actually be a Kahoot that you can find the questions as well. So that's where we're going to end on this part. So we went over the endocrine system, the male reproductive system, and the female reproductive system. Hopefully you enjoyed the video and learned something along the way.